Jacopo Prisinotti, Director of Network Management at EUROCONTROL, will be speaking first, followed by EASA, Dan Duzy and Anna Dedier from Aircrew Medical Section and COVID-19 Monitoring Programme Manager. Uta Koze will be presenting from the Airport Research Centre, the managing partner and lead author of the study. And then finally handing over to Daniel Skoglund, head of the APOC performance team at Swedavia, representing ACI Europe. Then you'll notice from the agenda at 15:15 we plan to get into a Q&A session. For the questions that you have throughout the next 90 minutes, please raise them through the Q&A functionality on the WebEx. We will not be stopping for questions after each of the individual presentations, but we'll refer them to the Q&A session towards the end. If we are unable to get through all of the questions, we will collate them and share them to the attendee list at the end with the answers from the relative panelists. So without further ado, thank you very much for your time. I'd like to introduce Jacopo Prisinotti, the Director of Network Management here at EUROCONTROL, for your introduction and welcome. Thank you, Jacopo.
Thank you, Stephen, and good afternoon, everyone. Welcome on behalf of EUROCONTROL to this webinar. I have to say I'm really excited because I've been just receiving the information that we have 500 people connected here on the 5th of August. And so this gives a light of the importance of this discussion and the importance in the value chain of the turnaround timing and the way that the operational stakeholders are really working together in an unprecedented way. And I think this unprecedented cooperation that I'm seeing throughout the different activities that we are doing is really starting to become a model also for other industries, and the way that we are progressing in terms of quality, even with all the difficulties that all of us, and as we all know, we have, I think it's making sure that the success story of this recovery happens. And I'm really honored and pleased to be part of this aviation group. So what I will do, I will just give a little bit of context quickly on where we are in terms of traffic and traffic outlook for the next weeks. And then I'm just going to close it down with some inputs for the discussion of today. So as you can see, we started off already in March with a very low baseline of 3,000 movements. We went through April, starting a little rise, but still less than 20% of last year's traffic. And then through May, we started to recover a little bit, but the first peak of recovery started in June. And you see during the slide where in June we started to have around 7,000 and at the end of June, 14,000 movements, making Europe be between 20 and 40% of last year's traffic. Everything went very efficiently well. We worked all very hard with airports, airlines, NSPs, and the network manager to ensure safe and efficient recovery. And up to today, we're doing really well. For next week, we are expecting more than 20,000 movements. So we are now average 50% of last year, and we're moving throughout August to the 60%. And in certain areas, as you can see in this last part of the slide, at the end of August, beginning of September, we will be around 70% and more, especially in the core area of Europe. Of course, this is all also with all the complexities, as you know, the state's different restriction, let's say this coming back a little bit of COVID, still is showing the resilience based on effectively all the hard work done to ensure that health throughout aviation is kept as much as possible. Now, if we go to the next slide, we will see the airport situation. This slide shows a percentage versus the demand and the capacity of the airport. Where the percentage is below 100 means that there's enough capacity to allow for the demand. And you see that throughout August until September, if we can scroll the slides, almost everywhere, and where it is not, it's around 100%, so it's really not an issue. There is going to be capacity vis-a-vis the demand, which is foreseen in the planning of the airlines. Again, this is a very robust type of information because it's the planning that the airlines are providing to us and the airport capacity, which is being provided to us in a very effective manner. And so all these figures are consistently robust, and variations will be very little. So as you see, until mid-September, overall in Europe, the capacity of the airports will be able to match the growing demand until 60 and 70%. Now, and the next slide will show to you that the biggest jump, the green part is the traffic growth in the major airports that you see below named. And you can see if we scroll the slide, that there's been a peak beginning of July, then it stabilized. Then the beginning of August, you see another peak of growth everywhere. We are adding this week more or less between 1,500 and 2,000 movements a day in the network. Then it's going to stabilize a bit around August with little growth, and you will see at the end of August, beginning of September, that there's going to be another leap up in terms of traffic around the major airports. And you see 14th of September, green almost everywhere. This means, of course, that that's the other leap, which will bring us possibly to 22,000 movements over the network. The next slide is just a sort of a little publicity I'm making, because it's our cabine de regie, and you will see it in our websites. So you have in a dashboard all the basic information. You can do it on daily basis, weekly basis, whatever. And you can, and we are also in a continuous improvement mode, and you will see a lot of things coming up in the period of September, October. So stay tuned. In the upper part, you see the overall general information in terms of traffic percentage versus last year, number of increase. You will see on the right upper big box the steep growth on the first days of August. The difference that shows the difference between the previous week and the previous year, and then you will see on the left hand side the flight by day 2020 on 2019. You see the beginning of August, the 43 going to the 50%. Below, you see the major airports and the different dynamics in the recent days from the 23rd of July to the 5th of August of the major airports, whereby I don't know if the naming is not clear on the slide, but of course we have had also now Schiphol coming up, which is the light green, vis-a-vis Paris-de-Gaulle was the one having the major flights until the beginning of August. If we go to the next slide, oh yes, they're there. I will just close down by the last two slides, where again I would like really to reconfirm that throughout this unprecedented cooperation we are managing to make this a reality. I'm quite sure that this would not never been the case if this cooperation which is happening at this stage in aviation would have happened. So I think we all should recognize that and build on this. Little publicity again here. We have opened the network function in our operations center to deal and support the airports even better. As you know, since a year now, airports are fully part of the network manager, and we are acting really, really hard to make sure that we can support the airports as much as possible. You have a phone number and an email address, but of course, H24, we are here to support you. And the last point is regarding the next webinar possibility. So looking at the success we had today of the 500 people joining, we are going to see after we will distribute the report at the end of the month of August, beginning of September, if to organize a further webinar to continue this discussion on this very important topic, with which will, of course, if dealt in the right way, foster even better the recovery plan. Now, on the last slide, I just wanted to have some words of thank. Of course, you're going to see a lot of the panelists are going to go through these very important points, so I'm not going to go through them, but I just wanted to make sure that I would recognize the important work that ARC has done in support. They've been supporting us for a long time. They are a very experienced consulting company, and they're helping us on this analysis of the COVID measures and the performance based on the EASA ECDC recommendations. Again, very important work from them in cooperation with Aéroports de Paris, Heathrow, Arlanda Airport, Stuttgart Airport, and of course ACI and IATA as major partners. Again, a very, very important cooperation between operation stakeholders, which is delivering that. And I think with this, I would just like to wish all the best for the discussions. And of course, we will be prepared to take them, as Stephen was mentioning, the question answer, but of course, after this webinar, to build on the work which has been done today in the next weeks to come. So Stephen, back to you, and thanks to everyone for listening.
Thank you very much, Director Prisanotti. I'd now like to introduce Anne Dedier, who is here as the COVID Monitoring Programme Manager from EASA. But first, as we get the slides up, Dan Doozy, Aircrew and Medical Section Manager from EASA, setting out the protocol airport guidelines and implementation. If we can bring those slides up, please, and allow them to be shared, I'll hand the microphone over now. Thank you.
Thank you, Stephen. You should have the slides coming up. Give me 1 second. I hope you can see them now.
We've got a grey screen.
Yes,
there we are. They're up now.
Yeah,
thank you very much.
That's fine. Yeah. Okay. Thanks, Stephen. So thanks also to EUROCONTROL for giving EASA the opportunity to take part in this webinar. Incredibly important topic. Just a quick introduction for myself and the rest of the team that is joining us today from EASA. I'm the lead coordinator at EASA, dealing with the return to normal operations cross-domain, everywhere where there's a medical element involved, of course, in the context of COVID. And primarily, of course, dealing with the aviation health safety protocol. Now, actually, I see that I'm on the wrong slide, so I'll just go back a view. Hold on. Sorry, coming back to the correct slide. Sorry about that. So my other colleague is here, and Didier was already introduced, project manager for the COVID aviation health safety protocol monitoring program. And for later on during the question and answer, we have our senior medical expert, Dr. Vigilius Valentukavicius, and our senior aerodrome expert, Sarah Parola, to support us during the discussions. So points 1 and 2. One, I think many of you, if not all, are familiar with the EASA and the European Centre for Disease Control joint document that was provided and developed to assure the health safety of air travelers and aviation personnel for airlines and air operators. It's a second revision, and I'm sure there will be further revisions on that. The guidelines place paramount importance on the health safety at every stage of the end-to-end passenger journey. So in an ideal world, if we all follow the measures, it would, aside from providing adequate health safety level, it would also streamline the passenger experience, avoid confusion, as well as reduce operational burdens and complexity for primarily the airlines. Now, as a second point there, we've identified a need to further support the authorities, and we developed some briefing materials, implementation materials, including some checklists that try to help with the implementation following the PSOE. For anyone interested, that stands for present, suitable, operational, and effective. Coming to the next slide. So points 3 and 4, monitoring and support to national aviation authorities and industry, as well as the industry charter, will be covered in the next 2 slides by my colleague Anna. Moving on to point 5, the modeling of health risks, as well as the development of hygiene measure repository. So for the modeling, if you read the protocol, it mentions that the preventive measures recommended in the operational guidelines are expected to be gradually reduced over time in line with a reduction of the risk level. So the modeling is all about trying to identify risk levels, and based on those risk levels, you would then see alleviations inside the measures, let's say. So this is work in progress. And to give an example, at the highest level of risk, you would consider medical masks to be worn in many cases, with some alleviations from that measure as we see lower risk levels. So for this work, we are using the bow tie principles, which is indeed proving to be very complex. And especially given the volatile and continuously changing circumstances that we're seeing out there. In regard to the repositories, there we have a twofold approach. One repository should cover the European area, let's say, in terms of measures that have been applied by each individual state. Of course, we are all hopeful that they follow the EASA ECDC protocol. But we are still seeing some differences. And the other repository aims at looking outside of Europe, trying to collect information on the measures and making all that information available on our website, for which you have a link at the end of this slide. Then for point 6, associated with all these initiatives that we're doing, we of course have communication and promotional campaigns ongoing to try to send out a positive message and be informative on all these various initiatives. And the last point on the safety information bulletins that are relevant for this discussion today are as the references are given there, preparation of aerodromes to resume operations, as well as the provision of ground handling services at aerodromes. So those are an overview of our activities, and I'll give the floor to Anna, who can provide you some further insight into this monitoring and other items. Thank you, Anna.
Thank you very much, Dan. Thank you for the opportunity to Eurocontrol and the partners to be in this impressive forum today. So on my side, what is important is to, going back to the protocol and putting things in a bit more of perspective. The protocol is indeed a set of recommendations. It's a set of guidelines which will deliver only if it's implemented. And when it comes to implementation, we really talk about implementation by all the stakeholders in the system, both regulators and industry. And not only to be implemented, but to also be implemented in a harmonized way as a set of collaboratively applied measures. So this is what we as EASA have been consistently now communicating as we set out to monitor the implementation of this protocol. What we see right now is that indeed impressive work has been done by the entire system, but we are pretty much still in the work in progress mode. We can be guardedly optimistic, but it is still work in progress. Why is it work in progress? It's because we still see different degrees of implementation of the guidelines in member states. Member states are ramping up. There is an evolution, no doubt, but we still see various regulatory approaches. Somewhere recommendations become law, somewhere there is a, let's say, less stringent approach. But more importantly, we see really some fundamentally different health safety requirements on state level, which does not help, and which does not also help the industry to find its way in this myriad of different regulatory settings, resulting in different practices that we see also among various industry players. The bottom line is we do see that public has shown trust in the system. People are starting to fly again, but to ensure that we keep the momentum and that we secure this public confidence and trust, we simply need to do more. And when we say more, we need more alignment in the implementation of the measures, and we need more monitoring. As you will see, as EASA, we have started the program 1 week after we issued the protocol, where we monitor together with a, let's say, club of industry players that pledged to implement the protocol, together the effectiveness of the measures. But we also are committed to support the national aviation authorities. As Dan indicated, we already produced checklists. We are organizing, we are meeting in the format of a monitoring group with our regulators to exchange on experiences to boost coordinated harmonization to the maximum extent feasible. And in addition to working with the authorities and with the industry, which has pledged to implement the protocol directly to EASA and ECDC under our industry charter program, we are also very pleased to actually say that we have also established a very important link with industry associations. In the past weeks, EASA established cooperation agreements with ACI Europe, IATA, A4E, EBAA, and ERA. And this will be also a very important forum to promote harmonized implementation of the measures by industry players, including those in the charter program, but also those who are still not in the program. The industry charter program, which is the next slide that I will show, and I will not take too much time for that. This is EASA. This is in fact EASA's monitoring program for the implementation of the protocol. We have launched it on 26th of May. We have invited industry who is ready to, let's say, on its own initiative, pledge publicly that they will implement the protocol, all the measures, and that they will also measure their effectiveness together with the regulators to feed into the review of the protocol. We are proud to say that today we have 39 airport operators from all over the world, gathering some of the major industry players in the, let's say, in aerodromes world, as well as 30 airlines doing business in the EU member states, but also neighboring states. We have operators and airlines from Norway, Albania, Egypt, Georgia, North Macedonia, Montenegro, Tunisia, Turkey, the UK, and the latest, let's say, edition, which is now opening up the truly international expansion of this program has been the joining of the program by the major industry players from Singapore. If you're interested, we will show at the end of this presentation the pages of the program for all of those who are still not in, but who are interested. Visit this link and you will get all further information. How the program works: we have weekly reporting against a set of predefined KPIs, plus any qualitative feedback that the industry is giving to us. The reporting started on the 6th of July. And we are currently preparing a monthly overview of trends. So we will be coming out with a set of identified trends and, let's say, aggregated values that we gather from this program. But what we can already share with you is that the program currently captures around 30% of the weekly traffic. We are benchmarking at this stage against the ACI Europe weekly data. We see that those industry players who have pledged to apply measures are applying them and are measuring. Relative to the total number of passengers, the number of suspected or symptomatic passengers handled on the ground or in flight remains very, very low. We are really talking about a handful of, for example, symptomatic passengers in flight per week. But we also see that a lot is happening, in fact, on the ground to make sure that in flight there let's say, as few issues and occurrences as possible. What are the main challenges that we have identified so far in this early stage of the program? Well, of course, we all saw the news, and this is not a surprise. There are issues with occasional not adherence to the requirements to, in particular, wear in particular wear face masks by passengers. This has been the case where this requirement has not been, let's say, implemented at state level that stringently. Certain airlines are also having issues with implementing the requirement of medical face mask, which is one of the key requirements at this stage as per the protocol. We have reports of issues in social distancing at airport. I think this will be the topic of also for today, you know, and I'm looking forward to seeing the study that will be the main, let's say, the main dish of this webinar. But we already see the reports that social distancing will be an issue, and we will have to talk about that. As well as waiting times. We have already increased number of airports reporting, in particular at boarding and baggage claim, waiting time of way more than 15 minutes, as well as queuing in the border control areas. What is also another trend that we see for the time being is that screening at airports is becoming increasingly common and very effective. Highest numbers we see, although still low to the relative number of passengers, are about the number of passengers screened, means thermal screening, and identified for further assessment, both at departure at arrivals. So these are, let's say, this is just to give you a first flavor of what this program will be focused on. All of the input, all of the data of our industry charter signatories, which have been doing a tremendous work under this program, will be fed into the process of the review of the aviation health safety protocol. We will be sharing our, let's say, experiences with the associations, with the national competent authorities, with the regulators. And until then, until the first report, which you can expect in, let's say, the coming days, we are showing you the pages of the charter. I hope that it will work. If it doesn't work, just use the link, which is in the slides, and we will very much welcome any questions that you may have in the Q&A session. I believe right now we are gathering them via chat.
Okay, thank you very much, Anna and Dan, for your interesting presentation. And as Anna's just referred to there, please submit any questions you may have for any of the panelists through the WebEx Q&A functionality available to you. Just a quick update, over 270 people are now connected to this webinar. So without further ado, I'd like to hand the floor, please, to the presentation of the airport study by Uta Koze. Managing Partner and Lead Author from the Airport Research Centre. Uta, over to you. The slides are just coming up now. Thank you very much.
Okay. Thank you and welcome everybody to this webinar today. So we had a busy time the last 2 months, I would say, because we did the study and it's in an environment where a lot of changes are every day. So we had to look at the news and have a lot of discussions with airport stakeholders, had workshops every 2 weeks and so on to grasp what is happening and also to try to model it and try to get an idea what are the implications. First, to give you a brief introduction. So the motivation of our study was really, so what do the COVID-19 measures means? It means several new challenges for the airports. And one major aspect certainly is the possibility to keep physical distance. And airport therefore need to know the passenger volumes and capacities of each area in the terminal in order to expand the queuing areas. Then also to realign staffing and allocation. This means so also resorting and arranging and do capacity demand balancing. So spread the people over the available space, which is still possible in the moment. Then also elaborate concepts for local health authorities, because many airports have to prove that they did the work and that they can handle. And what is very important, I think, in this respect is really that airports know about saturation capacity. So if traffic rises, when is the new saturation capacity? It's not back to 100%, so likely it will be lower as long the measures are in place. And last but not least, I think it's very important to prepare for ad hoc changes. We see this in the moment. So we have a lot of uncertainty and the very dynamic changes. So we can see that governments put something in place and regulate something. And then if you are not prepared and you do it more like a trial and error in real life, this can certainly jeopardize health, and the worst case is really this uncontrolled congestion situation and will lead to a bad reputation. So we see this sometimes that we have major queues and nobody wants to be in a queue in this kind of situation and environment. Therefore, what we think is very important in this constellation is to have a systematic assessment, and we do a simulation and do what if analysis, and we can, let's say, build a model and then also rise the traffic stepwise or reduce it, whatever, and see where are the bottlenecks in the system and where it's get critical. So first of all, we knew that the airport are confronted with conflicting objectives. So on the one hand, certainly we have to ensure health safety. On the other hand, we have to ensure handling capacity. And then everything shouldn't cost too much, or it should be financeable, because it's also regarded as a temporary measure what we do, and we don't want to build new airports now. So it's the characteristic of our study that we are looking, our focus is really in handling capacity and operations. So we want to quantify the capacity impact of COVID-19 measures. So we have all the measures but taken in place, but it's also important to quantify the impact on airport operations and capacity. Our intention was to consider a wide spectrum of situations. So what we used for was something like an example airport or something like a generic airport we wanted to use, which also includes certain traffic characteristics. So have transfer passengers, have like a main carrier, have low cost, and also holiday travelers and so on. So to cover all these aspects of different kind of traffic. And so the methodology for us for optimization was really to understand influencing parameters. So to test, to do what if scenarios and so on, to identify what are the influencing parameters, and then also do the what if to develop best practice. So to enable a smooth recovery and guidelines. And this webinar now wants to share general findings and share approach how we did this. And I think it might be interested if it's applied by airports, they can also be specific, they can analyze their specific saturation capacity. So the categories of impact we have, everybody knows, so we want to reduce the health risk by more stringent processes. So we do a temperature check, some airports do COVID-19 tests, or all airlines, meanwhile, once they have a health certificate check. So the increased processing time have been observed with additional questions, health questions at check-in and integration. we see changes in the passenger flow, for instance, suspension of simplified transfer flows. If Schengen flights, we have seen this and observed a Schengen flight arrive from risk area, and then they are subject to checking and testing or whatever, and they are then handled as non-Schengen. This could be the case. Keeping the distance, so we have like the social distance and queues and holding areas. So enlarging of queues, of the queue space, and also what has to be done is either you enlarge the queue space or you increase the throughput capacity. I will show this in an example later on, which is interesting. So the limited availability of processors, what we saw in the beginning was use only every second counter, lane, reclaim belt, and so on. This was possible quite long, but I think more and more other measures like plexiglass screens and so on come in place to enable each counter is used again. Delayed boarding and deboarding, we also observed like boarding by zone. We have a delayed deboarding, also have seen something like head start for luggage. And our main question is in this context really, what is the impact on airport capacity? I think this is an interesting graph given by EUROCONTROL in April. And we see two trends, so recovering the traffic numbers, and in alleviating health safety measures stepwise, but likely certain measures will stay. So this is a big question how this whole situation develops, and nobody knows exactly. So what does this mean for airport capacity? This is just an example graph. So it's a new airport capacity with COVID-19 measures, and maybe we don't come back to 100% again. And the big question is, will the health safety measures end soon enough when traffic gets closer to pre-COVID volumes? And if not, the airport will face a new saturation capacity. And this is also, I think, important for airports which are level 2 or level 3 regulated, if airlines can just take the flights again, and then there's a saturation capacity they cannot handle. I think that's a very important message. Our test environment is like a generic airport, but we used also the traffic structures of realistic traffic structures. This is first, so the new saturation capacity. This is a summary slide, let's say. So general findings, what we could see really, saturation capacity, we think is in the, for this example airport was 60 to 75%. We see here is like a fixed component, so it's a capacity loss really, and this is mainly because of physical distance. And this is very likely that COVID-19 measure reduce capacity with hardly any chance for solving with reasonable time and effort. So you could build more facilities or temporary or whatever, but this social distance is a big impact. We also see, which is nice, the flexible capacity at risk, these factors. And I think we could see and prove with our simulation that you can reduce the impact and get this green part, which is the capacity remaining closer to the red part. So there is a possibility. And but solving sometimes generally is possible, but maybe it's also costly. So it's also a trade-off. And the actual saturation capacity is airport specific, we could see. So it really much depends on the layout and local situation. We did, meanwhile, also as Airport Research Center studies for airports exactly with this topic on saturation capacity, and we saw similar numbers. So it was quite interesting in this range in the impact, but sometimes it was, so in many cases it was security control, but sometimes it was also gate hold room or baggage handling. So there is like a variation, certainly depending totally on the situation of the airport and on layout and local situation. So now I will go for the detailed results per terminal area to give you some more insight in the different aspects. First, I come to the health check topic, which is was in the last 2 months very challenging to cope with, because in the beginning it was no issue at all. So also the airport said, okay, this is, so we have like temperature screening, but then everybody was implementing it. It is still in place. So certainly it can detect people who have fever, but it does not detect person without symptoms. Then it's a question, reliable PCR tests, they are regarded as reliable, but they take long and are costly. then we also saw at airports fast antibody tests implemented, but they are not accurate. So it doesn't make sense to have this. Then there was a lot of discussion about health certificates and health passport, but there is no standard yet. So we see it's a very dynamic situation. What we saw last week was really this development in France and in Germany as an example, where they said, okay, all the people coming back from vacation, we need to test them. And so there's really like the governments are afraid that new cases are imported. And then they just said, okay, we will do a COVID test on arrival. And there was a lot of discussion going on. So we also said, okay, it's an interesting aspect now, which would come into place at the airport. If it would be airside, it would be really challenging. But God thanks. So I think France still has it. I'm not sure because we just were informed by ADP. Germany was thinking about it, but they said then there was a new measure saying, okay, you can also do the test within 72 hours after arrival. What you can see here, so we just set up such a situation. So this would be like before immigration even. So the passenger from risk countries, they would need to go into this area and register. So this is a testing area, consists of a registration area, could be kiosk or desk or whatever, and then also manual registration. And we also want to have, we have considered a fast track lane for pre-registered passenger who have a QR code or paper form. Then the PRC testing area consists of 32 booths. So we have calculated this with some input. We have discussed and gotten input from airports about this. And then we also said, okay, we just want to see how it looks like if a flight is arriving, because certainly arriving passengers, if it's like a peak, like a short moment peak you would create, and then you also need more facilities, certainly, because you need to handle these queues and so on and have to make it effective, because we have interlinked like this registration process, manual process, you have the testing, then you have another control and so on. So you need to have, I think we calculated here a lot of stuff needed also. And this is not to promote this, it's more like to show what is the impact if you would introduce it on the air side when passenger flow come in. And so you can really see that it's a huge area as well to organize, and all the queues and so on, also keeping distance in the queues and whatever. So I think it was an interesting observation, and we looked into different cases like a full, what happened if a flight is not checked, what happened if part of a flight is checked, what happened if a whole flight is checked, and then the interrelation also. And this was only peak hour of, I think we had a peak hour here simulated of 1,000 people, where 500 needed to be tested. So quite interesting. Then we also did a scenario where we said, okay, what happened if the test center is behind immigration? So we just said, okay, we just put it in here. And interesting was certainly the immigration control is like a buffer, or it flattens the demands. And in this example, so we could see that we need 30% less test units, which is interesting. And it also means we have no unnecessary immigration for Schengen from risk areas. Let's say here we would just say, okay, from flights arriving from Spain, they have to go, as an example, also to this test center. And in this case, they could just arrive as a Schengen flight and then go to the test center here. So we will see. We don't know exactly. We can analyze and check what is happening, what is better. I think in Germany, the test centers are all landside, so people would go out and then on a voluntary base first, go at this airport test center, or they can also choose to go somewhere to their doctor or whatever. So this is this was a little bit reduced from the requirements, at least, which is good. Looking into the check-in area, so we have COVID-19 impact. So this was most obvious for most of all. So we have the social distance in queues, and we have mandatory health questions at the check-in. Also, what we see, more passenger check-in bags, so that boarding and deboarding is less impacted. And what we also have observed was this earlier show up, really. So, and we have tested all these things and also said, what can we do, because the situation certainly gets worse. So we also looked at 2 mitigation measures, include health question and online check-in again. So first of all, we prolonged processing time, which was happening in the beginning as well. But then more and more airlines put health questions into online check-in, which helped a lot. And then also what we said, if people arrive earlier, then the crowd is even worse in the check-in hall. This was also what a lot of airport observed. And we also just tried just make a concept, adjust opening times for counters, so don't make them longer, don't open them longer, but overall change a little bit the opening profile and look what this means in terms of capacity. This is an example to show it, and from the simulation, it's a full service carrier. This would be the pre-COVID situation, so the capacity is adequate to demand. So we just have simulated a flight here with 4 counters open. So the worst case, then we simulated the worst case, so do nothing. So we say we have social distance, we have early arrival of passengers, also they check in many more bags. Also people who maybe checked in before with hand luggage only, they now also show up at the check-in desk. Then also health questions are asked to all passengers, and then we end up in this situation. So it's a big difference you can see, and this was also observed certainly. Then after optimization, what we have seen, so we allowed online check-in again. The health questions were asked online, so we could reduce processing time again, and we also adapted check-in opening, and then this could be solved. So I think check-in is something, if you work together in collaboration with passengers and airports and airlines, maybe this is solvable. Another example is holiday carrier. This is critical usually anyway, because people tend to arrive quite early, even before check-in is opening. So we see in the pre-COVID situation, longer waiting time already in the baseline, the queue space used to full extent. And then we have the worst case situation where we see queues setting up, so the same social distance, more early passenger arriving, more bags checked in and health questions. And then after optimization, with this kind of traffic, we still have problems. But what we can do certainly is to use empty space here. What we can say, because traffic is still low, what many airports are doing, they allocate then, so let's say closed counters to this flight. So there is no other flight, so they can use the space, which is also a good solution. So we have man counters 4, but the queue space of 6 to 7 counters. In this way, it can be solved. But if traffic rises, this is not possible anymore. From an allocation perspective, we also looked into this. So we had our baseline schedule and we reduced it by 50% during peak time. So the allocation was possible without using main carrier roles. So this was the main carrier. So, but with 75%, it was, so this is like the holding part. These flights were not possible to allocate, and we could allocate again if we change allocation rules. So this was a dedicated area for the flag carrier, and then we say, okay, we just have to discuss and likely have to change allocation rules to better allocate counters. So from summary for the check-in, what we could see was a queue space. We would say there's a 25% queue capacity drop from the calculations we did. Mitigation would be enlarge queue space, leave gaps in allocation, what I explained, and also increase the staff level to reduce queues, which would involve cost already then again. So if we use more staff to handle the queue is shorter, faster, but certainly it involves cost, and airlines have problems in the moment anyway, so they will not likely do it. Then we have this effect of earlier passenger show up. So the shifted demand in time, we could see that we need 2 to 3 times more queue space and wait time if this is not adjusted. And I think there's a very important message that people, maybe they are afraid to come early, but this has to be coordinated better. So I think it doesn't make sense if our people come early and then check-in is not adapted. So there must be something happening, or telling people not to come too early. So we have to adjust opening times. We do not encourage passengers to show up early, and we motivate passengers to self-check-in. And these additional health check questions, so we saw like up to 50% reduced throughput, including mandatory agent check-in, but this was solved certainly because Mount Airline do the pre-flight declaration online, and the health declaration is separate process. Could also be an idea. Okay, I go to the security control, which is quite interesting process because it has two components of impact. First of all, so yeah, what we saw, the different guidelines and recommendations of 2 meter, 1 meter 50, 1 meter, whatever. So we went in most of our analysis, had the reference with a 1.5 meter. So this results in a space demand of 2 square meter per passenger, what we can see here. So for instance, this is our example airports in a pre-COVID situation. It is like all lanes are open, and so we had the queue system is sufficient. We had a queue time of 10 minutes here. And in the post-COVID situation with the social distance, the same thing is the same number of passenger. We can visualize the same number of there's the same waiting time, but the queue system is not sufficient anymore, which is important. So if we now look into the factors what we have, so the impact on throughput, we definitely saw an impact on throughput because of social distance in the lane. The first instance, airports did like less drop-off positions due to physical distance. So instead of 2 people loading trays at the same time, only 1 person, or it could also be instead of 3, maybe 2. So there were more requirements to take off shoes, let's say, and especially if the body scanner is in use. So this was also seen. Then we have more trays to be checked in the scanner, and more passenger drop additional items after alarm at the walk-through metal detector. So this is also like there's a repeated scan of passengers, which result in, let's say, more trays at the same time. And then also we saw that the PET search takes longer due to more instructions and hygiene rules, also the manual bag search. And so there are some more other factors we have taken into account and in our simulation, so we can set up the lanes and then compare the impact. So this is on the left side, the throughput lane in this example of 170 passenger per hour. So this is like the before COVID, and now we have during COVID. You can really see that there's also like idle times because people have to go these short distances and so on. And then the biggest impact in this scenario, what we had was really this only 1 passenger could load the trays, and you can see here is really less activity. So we have almost like a 50% capacity decrease. We have done with a typical lane several scenarios to identify the measures, what kind of impact does it have. And so certainly here the major capacity drop came with a drop-off position, reducing it. And then we also looked at the other factors. And so we came from the baseline of 185 passenger per hour in this example for this lane to different kind of capacity reductions. We also did a combination of factors and so on, which was quite interesting, but this was the worst thing. We also looked at other setups. Let's say if we look into, we know certainly that every airport has a different lane and different capacities. It varies by countries and so on. And so we have also analyzed what kind of factor is the most limiting in this lane and the most problematic. So it's also for body scanner lanes and so on. Now to bring this back, if the throughput capacity decreased by lane, what kind of impact does it have? Because we have 2 factors. We have physical distance where we need more space, and we also have the throughput reduction. Here we see the baseline situation where in our example airport the queue system was okay, so we have like security throughput, regular social distance of 1 square meter, waiting time of 10 minutes, queue space was sufficient. What we then did is we reduced from our main peak, we took off flights and reduced the peak structure because it's always like related to the peaking, the peak structure, the capacity. So we looked into 75% and 50% of the traffic, and then simulated also with reduced throughput capacity. And what you can see here, so we assumed a traffic volume 50% less peak hour capacity, and we also opened only 50% of the lanes. This would be like, okay, before we had this peak, now we have this peak. And then we operate the same number of lanes, but the security throughput certainly goes down. We have assumed 25%. And we have this increased social distance factor, which means 50% and 50%. And this ended up the whole situation in a waiting time of 45 minutes. So it's a big impact. And then we said, okay, what are the factors? So we have to update staffing factors. And this was an interesting conclusion. Certainly, if we have to deal with the situation, in this example, we had like the traffic volume 50% reduced and the open lane with 70%. And so we had a factor and increase of 1.4, which is considerable. So there was also a discussion going on, oh my God, the airports or authorities releasing staff and security, but we need even more. So this is an important message. So for the impact, what we saw, again, physical distance, we have a 40%, 50% capacity drop, or we need double capacity to handle the same number of people in a queue space. What we can do is enlarge the queue space, increase staffing level to reduce queues. So this is what you saw in the example. And we can also do active crowd management, like if you have several checkpoints to better balance crowds. Physical distance in the process, this reduced the throughput, can reduce 25 to 50%. What we could see, we think, as measures are taken back, if you say, okay, where it's not possible to keep the social distance, a mask requirement is okay. So I think there's less impact, but still we have, due to the other factors, capacity throughput reduction. So we can apply other measures with the same health, same health safety, like the mask and the plexiglass, what I said, and optimize the staffing rules, so more staff per given passenger volumes. In the changed passenger show-up profile, what we could also see, so we shifted demand, time and numbers. This is like unpredictable factor. This is what airports reported to us. It's very unstable, so we have like load factors forecasted, but then another flight is coming in, and it's very hard to plan the stuff. So it's really like we need more demand-driven staffing and ad hoc adjustment, and we plan contingency factors in. This is an important factor and also certainly increases cost. This is always a trade-off if it's possible or not, but if we don't react, then likely we have issues in this respect. So now I go to the boarding gate rooms. We also looked into different boarding zones. Everybody knows, so this is like the pre-COVID suitable space provision, let's say. So we have like 3 flights handled at 3 gate areas, typical situation. This would be the post-COVID situation with a physical distance. So we also calculated factors like what is the change in required space, considering also every second seat is not taken and so on. Everybody knows about it. So the gate capacity reduced theoretically at least by 25%, but could also be by 50%. This depends a little bit on the gate layout and on the structure of the airport. So we have a heavy overflow into other areas. If we would stay with the 3 flights in this area, not possible. And we can optimize by allocate, so the allocation should leave gaps. So this is an example where the flight 2 was not allocated, and flight 1 and flight 3, they share the space of the gate 21. And this is what we observe, but if traffic rises, we don't know how to handle. We cannot, if we can still do this. Also important when we look again at this pre-COVID 3 flight allocated to gate area without constraints, and then considering also this factor of reduced capacity plus maybe earlier show up of passenger. If they show up earlier, then also they report earlier to the gate area, which can add more stress. So we did an analysis where people came a little bit earlier, and then we have like reduction in capacity, but also more passenger accumulating. And then we could also see that if we only then take 1 flight off, then it fits hardly again. But this kind of studies, I think, is important to understand what is the capacity impact. We also looked into physical distancing in bus gates, because bus gate is a resource where sometimes more flights are taken in which cannot be allocated to a contact stand. In the moment, certainly the main policy is to use contact stands. And this is a pre-COVID situation with 100% traffic, let's say, also 70% seat occupied. And we had here like 75% traffic saturation capacity. So we just removed flights to check the number of people in the space, what would fit to maintain the social distance. And so we also did analysis of, looked at different kind of gates, what we can see if you have an open gate and you can share easily the space. So the impact of COVID is rather low, and we recommend certainly to allocate of every other gate as long as possible. Then we might have generally open gates, but gates not in line of sight. So it's also like medium, the passenger cannot simply use other areas as they don't see when boarding starts. So this is irritating if you would sit somewhere else, but you cannot see because of obstacles this gate. So this is not so good usable. So you would avoid of simultaneous allocation in the same zone as long as possible to improve the passenger information. We also looked at the closed gate concept. So we think this is the highest impact because you can only, this was dimensioned maybe to hold a flight, but this is not possible anymore to hold the complete flight. You need to keep the social distance and so on. So it could also happen. We saw it for airports. We looked into it that this was not, that certain gates were not used anymore, they were not usable anymore. So it's to avoid the closed gate where not necessary. We have the dual gate concept where we have at many airports one level Schengen, the other level non-Schengen. We think this is more flexible because you have more space and you're more flexible to use gates. If on the one level this is used, the other level the people can spread out here. So this is also not so big the impact. Then we have also the concept, let's say in Great Britain, for instance, all people should wait in a central dwelling area with shops and coffee shops and whatever. And we see there is the challenge to balance capacity. So it could also be that it's better to make an earlier announcement of actual gate to distribute passenger better. So these are the different factors we have considered because it's very much dependent certainly on each airport. We also looked into the aircraft turnaround and deboarding process. So the baseline, what we looked into, so we looked into the turnaround process of a typical European flight, hybrid carrier, narrow-body aircraft, because the narrow-body aircraft, they have this short turnarounds also. So the main focus is on the critical path within the aircraft cabin. So we have the deboarding process, the cabin cleaning, and the boarding of passengers, which we looked into. So first of all, we heard this recommendation of back to front boarding, and we wanted to look into the simulation, what this means. So this is a simulation of a random boarding before COVID. So the people start to collect at the boarding gate and then board. And here also people accumulate more on the bridge. We have simulated it in a way that people should only a certain number of people can be in this bridge. And so it's really like from back to front. And what is interesting and what we really can see is that if you have the random boarding, more people at the same time can do in parallel the process of putting luggage into the overhead bin and being seated. And so when we really did this back to front, this took longer. But there was also a recommendation certainly for another boarding concept, which is like the window, middle seat, aisle concept, where we heard that this works much better than the back to front, but we simulated back to front because we got from ACI surveys the information that at a lot of airports this was done. Maybe it's not done anymore because it's dynamically changing. It was just interesting to see. And then we said, if we have this back to front boarding based on load factor, luggage boarding principles, the increase differs. And as a conservative approach, we said, assume 10 minutes increase could happen. So just to think about what kind of impact does it have on turnaround process. If we look into the deboarding process, I did a flight on my own and was amazed that there was not so much difference really. So if we look into the left side here before COVID and during COVID, this is like we assume that people keep this little bit more social distance and so on. But from the principle, we think there is not much change in the deboarding process. It's also that the crew member cannot really control how people get out of the plane. So the deboarding process, we would think, might be prolonged around 0 to 3 minutes, something like this for a narrow-body aircraft, let's say. And if we put this into place, we also looked into the cabin cleaning, but this was more by interview and by exploring. So the guidelines say that once a day more deep cleaning should be done, but this is done rather than not for a short turnaround or when a crew is changed or whatever. And we heard also, we discussed this also with a cleaning company, and they said we just send 2 teams through the cabin, so there's no difference. We heard other things where they said, okay, there's some additional cleaning for the touch points, and this takes as an integrated part of the cabin cleaning maybe 2 to 3 minutes more, so we just assumed this. And then if we put this together, we would say this would be increased in this case from 40 to 55 minutes. But I was also on a low-cost flight, and there was no change really, so it was not very much cleaned, and it's really in the hand of the airlines what they are doing. So we can test this and implement what is done. So we saw a trend also for longer ground times, but this was likely more because there was not so much activity going on at the airports in the moment. So we see this then. What's also important, maybe the other factors which might impact this could be like during the boarding process, timetic questions and so on, and unclarity, which might prolong the boarding process so that the people go slower to the aircraft cabin. We also looked into bus handling, which was challenging as well. If you see, this is a graph from Cobos, and they put in place the 2 meter, the 1.5 meter social distance, and they end up with so if you would have 150 passengers, you need 6 buses instead of 2. And this is also the reason why also low costers don't like to use buses anymore, because it's very inefficient. We also talked to airports. They said maybe operational unfeasible, this kind of thing, and maybe a trade-off is like put 50 people in a bus. Even it's not so it's like a trade-off to have like 2 times the bus numbers. We applied this rule into a example schedule we had from a bus building, from a remote bus building. And so what we could see is really we did the allocation of the buses for the same traffic, and we could see that we need 50% more buses for the same traffic. So we think it's unlikely that airports would invest in more buses. So we rather looked at the saturation capacity as well. And we said 70% of bus gates flight are still manageable with existing buses. So I think that's also interesting. Even busing is not a big deal at the moment, but it will come if we come closer to saturation capacity. I want to also touch immigration, which we looked at. So we wanted to look at the physical distance and queues required more space. So it's similar like in the check-in area. So the space requirement of the 2 square meter from 1 square meter to 2 square meters. So we have double space. And we also looked into one scenario where we said that this was also a scenario we saw at an airport, so that they said we have to ask more health questions and so on, or control all the passengers. And then because every passenger has to talk to an agent, to an immigration agent, we close e-gates. And in this scenario, we just look into this consequence. What does it mean? So higher social distance, and then also e-gates not available, and we certainly ended up in a chaos. So I think it's very important that if there is any additional process, that it should not prolong immigration time. Immigration process is at many airports a problem because staffing is always an issue, and you have all the peak loads coming in from arriving passengers, so it's very sensitive. And so in this example, we saw a saturation capacity of 50 to 75% of non-Schengen flights. To summarize immigration, so the physical distance is similar like with the security, what we saw, similar measures as well. Oh no, sorry, we have one interesting maybe. So the control inflow of passengers, we saw it as at other airports even before COVID, where immigration area got stuck and then people had to keep in the plane. So until so the deboarding was delayed, and we have also seen this in the beginning of COVID that there was a measure taken, just keep the people in the cabin and delay deboarding. For the immigration process, if there is a risk that there are additional questions to ask by the immigration officer, we see also capacity drop by 10 to 30%, or even more if there is no use of e-gates anymore. So it's sensitive. And mitigation could be like the pre-flight registration online organized by government. So like Greece did it or Spain did it. So that everybody before travel has to give their data and they get a QR code, and then it's much faster, this process. And also the check before immigration, a separate process would be a thing that you place people who could control the QR code, but not the immigration officer. For the new process, if you look into what we saw in the first video, that we would say a mandatory COVID test in the area before immigration. This would need for additional space and equipment. And also, if the process takes longer, we also have a delayed bag pickup, which has an impact on baggage reclaim. So I think mitigation would be the pre-flight registration online. What we saw would streamline the process, and also so do COVID test rather before travel for fast track, or let people go to the land side of the terminal, do the test over there. Then it's less crowded. So we also looked into the baggage reclaim area, the last process. What we could see also because of physical distance, so the waiting area overlapped now for simultaneous allocation of neighboring belts. So this is like before COVID, where we always use this 3.5 meter around the belt, which is IATA standard. And to position the same number of passengers around the belt, we would need like rather a 5 meter zone. So we have overlaps here. If we would apply this to our example airport with a setup, so good practice if traffic allows to allocate large belts to narrow body flights, and also leave gaps between simultaneous arrivals, and let group use overflow areas somewhere to only one selected person shall pick up at the belt. So this is like what we also see. Certainly baggage, it's a very individual thing, baggage reclaim halls. Some airports have a huge space, others have less space. So it's very important to analyze the space case by case and check what is there, was it possible. What we also certainly have to think about it is Schengen and non-Schengen traffic. There's a difference. Non-Schengen traffic is maybe delayed by immigration control, and then the likelihood that baggage is in the hall already before people arrive is larger. Then, and with Schengen flights, the risk that they have to wait and accumulate in the area is bigger. So we also looked into this Schengen process, what you can do if you have an issue in baggage hall. So the flight might be delayed if baggage hall gets overcrowded. This could be a measure if you run into this problem. So let's say the baggage flow process is the first bag on belt is here for Schengen passengers. They have a short walking distance and they enter the baggage hall already, and they have to wait here until the first bag, and then the people accumulate. A measure would be that you would say you move this waiting in the baggage hall where they accumulate into the aircraft cabin, which we have seen has been done. I think at Frankfurt Airport they did it, but they don't do it anymore. In the beginning they did it like this, but it may come back. Such kind of measure may come back if you have issues in baggage reclaim hall. So, and this would be a measure which would release baggage reclaim, but airlines wouldn't like it, certainly. So the impact for the baggage reclaim was really in physical distance, that the queue capacity drops again. This 25% is somehow coming more often. What we see, this is really this impact on social distance. We can mitigate with leave gaps in allocation, assign secondary waiting areas, delay boarding for deboarding for head start luggage, what I just explained. If we have more checked-in luggage, certainly we have a higher demand in reclaim capacity. We saw domestic flights also in Germany, which usually have maybe 10 or 20 bags, suddenly had 120 or 140 bags. And so this has also changed rules. So we have to consider this in the belt allocation, and maybe a mitigation could also be to speed up baggage delivery, that people don't wait and accumulate in the baggage reclaim hall. The delayed passengers show up due to upstream processes. Yeah, this is like we did analysis for an airport. They had really this problem that the baggage reclaim was very limited, and then they really had this imbalance of passenger and baggage flow. So we have to consider this as a belt allocation, and also let floor workers pick up and organize luggage so it can be picked up easier and coordinated. We also looked into transfer process. So just a brief thing. I think the most critical is the Schengen to Schengen transfers, which are usually short transfers. Pre-COVID, if we look into deboarding, walking, and departure gate, it's a one-stop check. So let's say a good connecting time could be like 40 minutes. In a post-COVID potential health check-in, so as a separate checkpoint, could be like testing a QR code with some waiting time, or it could be also like some kind of this more intensive health check. So we say if it's like 60 minutes increase. And then we also have the potential health check at immigration, so mixing with other passenger, which makes again require that passengers have to go to transfer security. So this is like the one-stop security would be abandoned, and which would be like horrible for 40 to 75 minutes. So I think this is not what airports would like to see, and airlines also not. So this is critical. We also looked into an example with the increased connecting time. These are really like real data from an airport, which a lot of connections in Europe. And what we could see here, if we say the MCT of 45 minutes could turn into 60 to 75, we would really see that 30 to 45% of the flights here would be impacted of the Schengen to Schengen connections, which is difficult. At mitigation options, we see the avoidance of unnecessary mixing with unclean passengers. So what I discussed in the beginning, don't send Schengen passengers into non-Schengen areas, have efficient transfer checkpoints, and also fast tracks may be important to organize this for transfers. Also allocate to reduce the allocation can be considered to reduce walking times. And also what I heard in Germany, they said, no, transfer passengers don't need to be checked, so they should be checked at the final destination. But how this works, I haven't understood so far. Let's see what kind of concepts our government will present. So, okay, as a summary, I go now a little bit faster, so they have some more time for questions and answer. We have looked into the different process chains. Where does COVID-19 add time? So when we look into this, we could see, so the health check, what we thought in the beginning, maybe for all departure passengers would be mandatory, is not implemented. For the check-in, we saw like maybe bigger transaction time, but this is also mitigated by online. Maybe we have more carry-on luggage, so there might be an impact. And also for the boarding and turnaround, we might have some impact. But I think the most critical, so we have the mandatory delays here, the red one, but the risk factors for delay, what we have here, it's really like if check-in is not cannot handle expected traffic because it's still a little bit too unpredictable, and the same for security control as well. So I think we have some risk factors here that passenger might be delayed in the process. But overall, we don't think so. It's maybe 0 to 10 minutes and more. This is a risk factor we have to take into account individually. For the space, so where does COVID-19 require more space? We can also look to the factors. So we have a lot of more space requirement. Certainly with all this, what we have discussed. So we have like really this 50% more queuing space required. And for security, it's massive because we have the impact on throughput and also the impact on social distance. So we think we need more queue space and maybe even more if we have issues to staff correctly. So, okay, so let's look for the arrival process. What would be changed mandatory? So if you have, say, deboarding maybe take a little bit longer, it doesn't need to be, but maybe take a little bit longer conservative. If we have this health check, if implemented, this would be like a big factor, especially for transfer. For the immigration process, we see mainly if the process time is not changed, if immigration officer don't do anything, but if you cannot, if you have more, this critical with e-gates or whatever, and the EU passport not used anymore, whatever, so we can have this longer waiting time. For the baggage reclaim, what I explained could be like, could have a feedback loop to the deboarding. So let's say if you have an issue with the baggage reclaim, could also be an issue with immigration, that you have an issue with the deboarding here, and which is a feedback loop. So there's a risk. So, okay, so we see here like adding 5 to 20 minutes possible, excluding health checks. But yeah, so this is really dependent on what is happening in this area. Very airport specific as well. And for the space, what we could see, so with the health check, so depend on operational principle. In our example, we implemented like we had like a 1,000 square meter area. I don't think that airports would like to see this on the air side. For immigration, yeah, we had this queue space increase as well. And maybe if staffing does not react adequately, we need even more space. Okay, I think, thank you very much for your patience. I think I covered all topics, and welcome for questions.
Peter, thank you very much for presenting the findings there from the significant and in-depth study that you've undertaken. We will turn to questions and answers very shortly. We've still got over 260 people connected. The video and slides for this will be available at the end online. So without further ado, I'd like to introduce Daniel Skoglund from ACI Europe for the view. Daniel is the head of the APOC performance team with Swedavia. So without further ado, if I can pass over to you, Daniel.
Thank you very much. Yes, my name is Daniel Skoglund. I work at Swedavia Stockholm Airport. At this meeting, I'm representing ACI Europe. Together with experts from Airport de Paris, London Heathrow, Stockholm Arlanda, and Stuttgart, we have been responsible to contribute with the airport perspective to the study. From the ACI standpoint, we have fully supported this project since day one, and we are glad that experts from mentioned airports have actively participated in this study. They have brought a wide range of knowledge from different departments, processes, and local challenges to the study. We at ACI strongly believe that the outcome of this study is of interest for our airport members, since it has taken several processes and scenarios into account, balancing the recommendations from EASA and EASA with national guidelines and regulations. ACI hopes that this study will act as a step in the right direction for airport management to focus on data-driven decisions, and at the same time encouraging collaboration between airports, authorities, and regulators to achieve joint decisions which take both nationally and international differences into account. ACI would like to thank EUROCONTROL and Bruno Dessart for facilitating this study. This study is definitely in line with your mission to support European aviation. But we would also like to thank the team at ARC under the lead of Uta Kose. ACI is very pleased how ARC has set up the project and how they're able to come up with the result in such a short time frame. Their ability to translate all involved actors' input and requests into a very presentable result with simulation videos was very impressive. This will be of great importance as the study is presented at other forums. And to summarize from our part, ACI is very glad at this result, to share this result with the wider aviation community. We are certain that this kind of collaboration between users is key to achieve a safe and sustainable future in aviation. So thank you very much, all of us, and hopefully this will be of great benefit for all of you attending this meeting as well.
Thank you, Daniel, and I'll echo your thanks to everyone involved as well. We'll now turn to the question and answer session. We've had over 30 comments throughout the presentations by the panelists, and I thank you all online for taking part with that. We've picked out 4 so far that I'd like to moderate through with the panelists. So the first question that we raised, we'll take them in time order when they were raised, was from David Gamper. which is, I guess, a question I'd like to address first to EASA, maybe Anna or Dan. Is there real evidence that thermal screening is useful or accurate based on a cut-off temperature? I don't know whether either of you'd like to take that question first.
Steve, thanks for that. I think our colleague, who's the doctor inside the panel, Elias, might be best placed to answer this question. So he's with us, so he can answer.
Good afternoon, everyone. Do you hear me? Hello?
Yes, we hear you. Thank you.
Okay. So, senior medical expert from EASA. Yes, you're right. Well, we can say that the thermal screening is not the sharpest knife in the drawer. That's clear, and it is, it's really widely accepted, and we know it. It has lots of drawbacks. It needs, the equipment. It needs the people to work with that. It needs that regular recalibration, other things. That's clear. On the other hand, it also has some good features. For instance, it's good for picking up the advanced cases when the people are traveling already with a fever, and the cutoff temperature is 38 centigrades of Celsius. So basically, it is also also this as a consequence put a kind of the psychological pressure for those who are trying to sneak into through the the checks. And we know that actually we know the people, they do not like to stay in the another land, another country, and get be medically treated. They always are trying to travel back home. So the tendency is always here. So for this reason, so basically, as a all in all, I would like to say that yes, if we would think about this as a kind of the only one measure, of course it's not sufficient. But as we already stated that in our guidance, that all measures shall be used in combination. So to some extent, thermal screening has its own place in this process. Thank you. Over.
Thank you for that input. Moving on then, that question was from David Gamper, who's the Director of Safety and Technical Affairs at ACI. Thank you, David, for the question. We'll turn now to a question by Stefania Tomasini, the Regional Manager of Airport Passenger Security and Cargo from IATA. Stefania's question, did the simulations at security, so Uta, this one's coming for you, I think, take into account also the summer-winter period factor, which would potentially impact the waiting area capacity, also for boarding and disembarking? So did the simulations at security take into account summer-winter variations, potentially, which would impact the waiting area capacity? Uta.
Yeah, so certainly this can be taken into account. So we had set up this general layout of the lane, and we just wanted to see and look into scenarios. What is the impact of each single measure? Certainly, if we say this is easily done, we can say we have we have more trace by passengers. So we would just put into the simulation the increase in trace of passengers, and then this would be a rather capacity drop down. So, but we had a relationship like 185 passenger and the baseline, and certainly this is like a generic study. So this is easy to change the parameters, because we can change every single process, every single parameter in the simulation. And we have also done, because every airport has like slightly different throughput rates. I know in Germany they have certain things like black alarms, and which other countries don't have. And in Germany, for instance, lanes are much slower than in other countries. So it really depends on local factors, and we can take this into account in a simulation. No problem.
Okay, thank you. I think the next question is for you as well, Uta, which was from Alexander Holz-Richter. How does the calculation take into account that distancing is in many cases only an obligation if wearing face masks? So how would this change the capacity?
I think you should look into this. I think we looked into the perspective from an airport. We also did studies for airport in this respect, and they have to prove that it's possible to keep the physical distance. And what reality shows, certainly it's not possible in all situations. So in particular, in the beginning, it was taken into account for security lanes, very strict, and then we could see that capacity drop was so heavy, like 60-70%, that they had to bring it back and say, now you can wear a mask. And so certainly it is like a recommendation and not an obligation. It also depends on local health authorities. I say what we experience even in Germany, we have all the different federal states and who do the interpretation and the rules, and they act very differently. So at some airports you are allowed to do this, and at other airports not. So this is really interpretation and guidance for local health authority as well.
Okay, thank you. Did anyone from EASA want to pick up that question at all? I know it was specifically about a calculation, but the medical aspect? I'm seeing no. Okay, thank you. We've got a couple more questions from Chris Dodson from IATA. I think, Daniel, they're both going to come to you, but I'll start with the first one here. Airports with ACDM implementations provide a predicted TOBT. Are adjustments being made to take into account the COVID impact on turnaround times?
At our airport, we haven't used that kind of system, but it's definitely interesting to look into on the passenger process. Usually the ACDM process is focused on the outside, the airside processes, but I think this is definitely interesting to look at. So no is the answer, in short, sorry.
Okay, thank you. So no was the answer to that. And secondly, from Chris, are airport operators and their ground handling agents being seen to provide airports with significant revised minimum turnaround times? Again, Daniel, are you hearing anything from there?
Not from our airports, and in the wider community that I've spoken to, we are in discussions with the ground handlers, but it's more a question to the airlines on how they estimate this. It's a challenge that I think we will see more about during the autumn.
Okay, thank you. That brings us to the end of the 5 questions I've got. I'm just going to fill 30 seconds to see if there's any more questions that arrive into the inbox for us to run the question and answers. But before I close completely, I'd just like to express my thanks to all of the panelists for your time, not only obviously this afternoon, but in your preparation, of course, in the preparation of that in-depth study. I'd like to thank, obviously, all of the participants for contacting and connecting in today, over 270, which was absolutely amazing. Thank you very much. And I'd also like to thank the support staff here at EUROCONTROL, who you can't see, but who've been desperately busy in the background to ensure that this has run very smoothly with all the practices in the background. So my thanks to everyone. I see no more questions. And so thank you very much for your attendance and for dialing in. Thanks once again to the panelists. You'll see the link there, the Q code, if you need it, to get to the recorded version of this webinar, and we'll make sure that it's available on the EUROCONTROL website with the slides towards this end of this afternoon. That's me signing out. Thank you very much for your attendance, and we look forward to hearing you soon, seeing you soon. Keep safe, everyone. Good afternoon.